And thank you for holding this hearing and for your steadfast advocacy on this. We know that the majority of adults and people with disabilities want to live at home. We also know that chronic underfunding of home-based services has taken this option off the table for many, and it's left hundreds of thousands of people on wait lists all across this country. The failure to invest in home-based services not only harms people who need care, it also harms the workers who deliver it. Home care workers, who are more likely to be women and people of color, earn a median wage of just $12 an hour, and they are 3 times as likely to be in poverty compared to other workers, and they are less likely to have employer-sponsored benefits like healthcare and paid leave. The COVID-19 pandemic has made these challenges even worse as caregivers have delivered essential services in jobs where social distancing was nearly impossible and personal protective equipment was alarmingly scarce. Ms. Widener, you've shared that as recently as last year, you were earning $12 an hour as a home care worker. Can I ask you to say a word about how that has affected your financial security?
Yes, thank you. So the low wages in home care have been really difficult. It usually means that I need to work more than one job to make ends meet. I'm working more than 80 hours a week. I don't have days off. I get paid 8 hours a day, but I really provide 24-hour care. And a lot of that means that I end up in a lot of debt. A lot of it's medical debt, but there is others as well. And it's nearly impossible to climb out of that debt when you're living paycheck to paycheck. It's emotionally, physically taxing, and then having that financial stress looming over you just makes it that much harder to get in the correct headspace to complete my job the way I want to.
Wow. Well, I very much appreciate your sharing that. You know, under these conditions, it's no surprise that states are reporting a shortage of dedicated home care workers. And despite the growing demand for home-based care, the turnover rate in direct care jobs is as high as 60%. Ms. Shahid, you've spoken about the shortage of home care workers where you live. How has this affected your ability to get the care that you need?
Senator Warren, thank you. You're asking how has the shortage affected me?
Uh-huh.
The shortage greatly because I'm unable to access without the home health aide coming into my home and assisting me with my daily living. My world comes to it slows down where I'm not able to access outside of my front door because I'm totally dependent on them to do things for me that I am now unable to do for myself. So the shortage, get my quality of life goes downhill when I don't have the home health aide coming into the home to assist me with those things that I need to do in order to be living independent. The shortages have just have I my things are not well because of the shortage of workers, and there is the shortage of workers because there is low pay.
Yeah.
And until that is resolved, we're going to, this will, it just continues.
Yeah. I appreciate your underscoring this. And I think Mr. Kingsmore said earlier that if he couldn't get access to home-based care, then he would be forced to live in a nursing home, or he would be back at home without the quality of life that he has now. I worry about the fact that too many people are forced into nursing homes or other congregate care facilities because they can't access the care they need at home. And the pandemic has just made clear how devastating the consequences of those decisions can be. As of January, 23% of all COVID-19 deaths in the United States happened in long-term care facilities. So right now, Congress is considering legislation that would make an historic investment in home and community-based care to ensure that more people can access these services. And that starts with treating home care workers like the essential workers that they are, by paying home care workers a living wage, by providing them with good benefits, by ensuring that they have the right to join a union. Ms. Widener, I know we're running out of time here, but can I just ask you just to say a word about what those investments would mean for you and for the people around you?
Yeah, absolutely. I mean, invest an increase in funding for home care would change absolutely everything, honestly. I mean, having access to a living wage and benefits. I don't know what a day off is. Health insurance is incredibly expensive for me on the marketplace right now. And most home care workers can't even afford it. So we're healthcare workers that go without healthcare. And it would mean turning home care jobs into a professional healthcare career. That means that we would increase the workforce. People would be able to stay in their jobs. And that means that people would be receiving care, the care that they need and the care that they want. Um, families, families need this investment, and care workers need this investment as well.
Right. Well, you put it very well, and thank you very much for that summation of what's going on here. You know, home-based care is essential infrastructure for families. These investments provide necessary financial security for home care workers. They ensure that more adults and people with disabilities live in dignity in the setting of their choice. And they would also allow unpaid caregivers who have taken leave from their jobs to care for a loved one to be compensated for their work or to return to the workplace if that's what they want to do. As our population ages, demand for home-based care is only going to increase. So the time for us to act is now. I am ready to join you, Mr. Chairman, in getting this done. Thank you.
Senator Warren, thanks very much for being with us today, and thanks for your questions and your advocacy. We have work ahead, and this hearing helps us light the path forward for that work. But thanks for working with us on this. And I don't think we have